Welcome. I'm Leanne Scales from Wachusett Community College, and we are delighted today to be welcoming an alum and also a current student and an alum who are going to tell us a truly amazing tale of working on the front line in this pandemic and what they faced, and hopefully a little advice for all of us as we move forward and think about our careers. I'm joined today with Heidi Burke and Branden Burke. Heidi graduated from Wachusett Community College with her nursing degree. She also graduated from Worcester State University. She is currently working as a nurse. Branden graduated with his EMT, and this May, he will be graduating also with an RN. So welcome, both of you. Thank you.
Thank you.
So Heidi, I'd like to start with you. Well, actually both of you. It's a tale we hear a lot here at the Mount. There'll be an aunt and a nephew who are both nurses. There'll be a mother and a daughter, a father and a daughter, a father and a son who both have chosen careers in healthcare. If you could both speak to us a little bit about your family and that dynamic, and why do we see it?
Yeah, so I think it, because my mom graduated when it was around 2013. Yeah, 2013. Mm-hmm. I kind of watched her like progress through nursing school and everything, and I saw the struggle and everything, but when she graduated, she really provided our family the opportunity to really excel in life, I believe, because before that, like, she got a degree in psychology and everything. Mm-hmm. She was bouncing around, and once she got that degree in nursing, and like, she'd come home every day and tell me about patients that she had and everything, and I was just wowed, like, with the caring ability and everything for her to have that compassion and everything, and I feel like she kind of sent that down to me, familial-wise, and it really encouraged me to be like, I didn't really know what I wanted to do. Like, you bounce around, you want to be a teacher, a police officer, all of that stereotypical when you're like an adolescent, and something you don't really hear about a lot. I mean, you hear about a doctor and stuff like that, but you never really hear about a nurse a lot, and I think my mom really becoming a nurse really encouraged me to kind of follow in her footsteps, because I saw really all the opportunities it can provide for you.
Well, we're sure glad you did.
Yeah.
And thank you.
Absolutely.
Thank you. So in a minute, we're going to talk a little bit about what you saw happening in New York, Heidi, and following the call to pursue it. But before you get to that, I've also heard that in your work in our region, you've heard a lot from your colleagues in healthcare about the reputation of the Mount's program. Can you talk a little bit about that?
Sure, absolutely, and I can touch a little bit too on, it kind of joins together with encouraging Branden to attend the Mount and the incredible foundation that you actually receive from the Mount for nursing. So being in the fields, you can actually, and not just, you know, pump up the Mount, you know, in this, but you can actually see the difference as far as education goes that I received from the Mount, and having colleagues, you know, say to me, you know, there was things that, you know, I knew maybe starting in the field, had a little bit more experience with, and them say, you know, well, where did you go to school? You know, because I didn't learn that while I was in school, or I didn't, you know, have the opportunity to see that, you know, while I was in school, experience that clinical, you know, settings. So I believe, you know, for me, I had already had a degree from the Mount in criminal justice, and then I had transferred to Worcester State College and received my bachelor's degree in psychology, and then chose to come back to the Mount, where I could have continued, you know, on at Worcester State, but chose to come back to the Mount for the program in nursing because the reputation of the Mount in the nursing program, yes, I mean, you hear it's very, very tough. It's very rigid. It's, you know, but again, it's the best. You know, I mean, the reputation of the Mount as far as their health degree programs, or, I mean, actually any, you know, program here has a very good, you know, reputation. But I knew coming back here that I was going to receive the education that I had so desired. You know, so I was lucky. Yeah.
Well, we're sure glad both of you did. Yes. I'm glad you both chose the careers you're in.
You know, in that, just, you know, really quick, in the encouragement of Branden, he actually in the beginning was thinking about going into the field of, physical therapy. We had visited 4-year schools, we had long discussions, in our house about, the Mount and what the Mount could provide, and I think sometimes younger, and they think, going away to school and, the 4-year degree, and having that college away, dorm experience, all of those things, is something that they are, one, sometimes encouraged to do, by society sometimes, otherwise, and sometimes, schools may, encourage that for them. And having those, discussions with him to say, what is your goal? Where do you want to see yourself in the end? And we talked about, the different opportunities, at the Mount, still visited 4-year schools. I can remember being on the highway, the exit just before Bridgewater State to visit the school, and him saying to me, "Mom, I don't know if this is what I want to do." We pulled over on the side of the highway, and he said, I said, "Well, what do you want to do? Like, what are we doing? We're almost, and he said, well, he's like, I didn't really, I didn't know how to, tell you, I didn't know what to say. He's like, I'm really thinking about going to nursing school. So then we get into the, discussion of, the Mount has an absolutely incredible program. You saw me go through this program, they have an incredible program. The other thing, the expense-wise, yes, I mean, you'd probably get a really good, education going to a 4-year school, but you can't beat the Mount's education, and you can't beat the cost either. So what's your goal in the end?
It's an amazing value.
Yes, absolutely.
Yes.
So that's where, he kind of also led into, the nursing program. And I think he was, sometimes, the male nurse, aspect, sometimes, there's way too much, feelings, that males or anybody should have to think that it's an all-female field, because it really isn't. It's, definitely a shared field now. So I encourage, anybody to attend nursing school. So.
Good advice. Good advice. So let me take you back to March. So this is when I think many folks in the United States were realizing that this pandemic was growing. It was growing in severity. It was growing in number. And you are a travel nurse, and you see a call for a need for nurses in New York. Tell me about that day, what you saw, and what made you decide to do what you did.
So I did start travel nursing the previous September because I had said, once all my kids graduated from high school, that was my goal. I was going to travel. I was going to see the world. So come March, I had ended one of my travel it was just the end of February. I had ended one of my travel contracts, was looking for, another opportunity. Where did I want to go next? Where did I want to travel to? Then the pandemic hit in March. And so there was a lot of, when I was researching, there was a lot of needs coming up. New York was the epicenter. They were struggling. They were advertising for the need for nurses, doctors, and all of that. So, I mean, I basically said, and I don't know how it really hit me, but I've got to go. This is, part of the reason why I became a nurse. I mean, sometimes that fear kicks in. That you're going to be right in, you're going to be right in the thick of it. It's going to be all around you. But I had talked to my family and said, this is the reason why I became a nurse. Yes, it is, scary, but, I want to care for people. I want to be there. I want to be able to help. So, I mean, that's basically where it started. It wasn't as difficult for me to get to New York because people weren't really looking to jump, to go.
That must have been a quick
so
drive.
It wasn't, as many phone calls, to be able to get there. So I actually went the first wave, they call them waves, for hiring nurses to go, and I was actually the first wave that went to New York.
Now, we've all seen the coverage of New York and the lack of PPE, the lack of equipment, the lack of ventilators, the urgent cry from the governor, from the mayor for supplies. as a healthcare provider working in that, what was it like from watching that from the inside?
Well, watching it from the inside because we experienced it, you know, and it was somewhat, you felt like a battle, you know, difficulty to be able to, so the facility that I had gone to was a facility that had been shut down for some time, and they opened it up specifically as a COVID unit, and they put in like over 360 beds in that one location. And we didn't have, so to say, the proper PPE. And yes, it was right in the beginning, you know, so everything was the unknown. So as far as being able to, I mean, they wanted to just issue surgical masks. But, you know, then we're hearing, you know, it's droplet, it's airborne, I mean, really nobody knew, you know, and what's the proper mask to wear, you know, an N95 mask. So when we finally were able to get, you know, N95 masks, after kind of fighting for them for a little while, it was, we got issued one a week, you know, so, I mean, everything they said, you know, was based upon the CDC, that, you know, the CDC says you can wear the same mask for 5 days, so it was difficult. The shortage in medical supplies, you know, and really kind of feeling like you were working in the fields, you know, that you were, you know, working, you know, and just trying to put together whatever you could in order to get by, you know, to be able to care for your patients properly. So it was very difficult.
And patient care, I mean, from what I've heard talking to healthcare providers, also very different. Often a nurse is that bridge between the patient and their family, but we had patients with no families visiting, you know. That must have changed the way you provided care.
It certainly did change the way we provided care. It also was very difficult seeing our patients without their families present, and patients who we knew, for them and for their families, that they may not ever see their families again. So you kind of develop a little bit more of a caring, nurturing environment surrounding your patients, because you really have now also become their families, and you're trying to bridge that connection between them and their families, and doing whatever you can, you know, whether it's you're using your own phone or, you know, bringing in iPads or anything to be able to have them have that opportunity to be able to still have that connection with their family. Maybe sometimes in those last moments to be able to say goodbyes, things of that, you know, matter. So we did really kind of become, you know, their families also.
Thank you. And Branden, so you're back in Massachusetts working on your education, and you know Mom's in New York. How are you staying in touch with Mom and talking to her through this process?
Yeah, it was difficult because just the uncertainty of the pandemic. If my mom were to get sick, like what was going to happen, because it was so new. And she was working very long days, 12 hours a day, 7 days a week. And we were keeping in contact, FaceTiming her when she could. But honestly, it was hard to keep in contact because she's just busy all day, and then she needs to get her rest, and then over and over again, the same workflow. And it was just very difficult trying to, just seeing it on the news especially, because the coronavirus is just dominating the news. And that's really what you see, and it like influences your perspective on how you feel about it. And then you have, my own mother was in the middle of that, and it's just crazy because in New York City it kind of dominated the whole world, and she was there, so it was definitely a different perspective. It was hard. It was emotional seeing my mom there. She was tired, telling me about patients that she had struggled with, and then the families, they can't go and see them. So her having to become their family and then see those patients struggling at the same time, it was difficult. And then from the whole family aspect, we definitely struggled with it.
I bet. So then fast forward to June. So June, And really, did I hear this right? You placed 2,000 phone calls. That is persistent to volunteer to go to Texas.
Yeah.
So tell me about the call that came and how you responded.
I think my mom had actually seen on Facebook that they were deploying more, they need more resources in Texas, more nurses, more CNAs, more EMTs. So it was kind of a split-second decision where it's, do we want to go or not? And we kind of said, you know what, we're going to try and get through and then we'll see what happens. Yeah. So we called about, I think it was 2,000 times between both of us. So I think I got through. Because the phone was busy. So yeah,
you couldn't so you couldn't get through to even to offer to volunteer.
Oh, yeah.
Yeah, everybody was calling through. Everybody's trying to get through because they just want to provide the aid. And I think I got through for you. I think what it was.
Well, so it took 3 of us. So what happens is once you become a reservist through Crucial, they'll send you a message, you know, are you available to go? Mm-hmm. So I get this message and I'm kind of doing the struggle of, what do? I've already been the New York thing. I came home kind of, you know, decompressed. What do I do? But I knew it was, again, the calling, you know, so I got the message and had seen that they were also looking for CNAs, EMTs, and all of that. And he said, I want to go.
Yeah.
So I said, okay, well, we'll go together. Yeah. You know, we'll do a team. Let's see if we can get in together.
Because if we go together, then we have that support system in Texas. Yeah. Whereas in New York City, if it's just her, you know, it's just her in a hotel room every night, you know, and then we could support each other in Texas.
Yeah.
I'm glad you had each other.
Yeah.
Branden, can you walk me through your first day from when you walked in the door?
Yeah, so my first day I was assigned into the ER, into the emergency room. And I've worked in the ER before, but it was never to this scale. So we walk in the door and it was insane. The amount of alarms that were going off. If you've ever been in a hospital before, just imagine every single patient, their alarm going off. All these staffs, doctors are running around. I remember walking in and they bring us to get our N95s and our gowns and stuff. Then they tell us that we have to wear our N95s for however long. I think it was 3 days, which an N95 filter only lasts for 12 hours. So, and then I remember seeing EMS come in. So the EMTs, 3 consecutive times within 5 minutes, they had brought in patients that were actively coding, so they're performing compressions on them, and it was like a wow. It was mind-boggling, like the amount of sick people that were in that ER that day. And then, so what split the COVID patients in the ER from the healthy patients was just like a plastic drape. So you'd see all the nurses and EMTs come out of the plastic drape all in their PPE and everything, and it kind of set in that this is a real thing and that this isn't anything to joke about. It's the real deal.
Right. And then on top of the intensity of the work, your schedule was, so how many days on and then 1 day off?
So we did 21 days straight, and it was 12-hour days, so 7 days a week, 84 hours a week.
And Heidi, the same schedule for you?
Yes.
So how did you get through that, both of you?
Yeah.
That's intense pressure.
Yeah. It's hard. At first, it's definitely, I had a lot of coworkers who had come down to Texas with us who, they just couldn't do it, so they left. It's kind of, you're there, you learn all these skills, and then you want to give what you've learned. You want to be able to provide that for other people. So it's kind of that driving force from inside that drives you to provide patient care to other people. You definitely have to have that intrinsic motivation in order to be able to care for other people for that distance of time, especially working 21 days straight at first. Mm-hmm. It's not easy. We had a lot of people drop out, but you kind of get in that, you get in a very specific routine. Mm-hmm. So it becomes the same process every day. You don't see the same stuff every day, but you get used to it.
And Branden, I know when you started this process, you were a trained and working EMT.
Yep.
And throughout this process, you said your career goals have evolved. You now know where you want to go next, which is?
The ICU. Yeah, I would love to be an ICU nurse. So my first day, I was in the ER, but then I got transferred to the intensive care unit to work as an ICU tech. And that's really where I had seen the sickest patients. They were on ventilators, supporting their lungs. They have all these medications going, just trying to maintain their blood pressure, their heart rate, and everything. So basically, they're on life support. And those nurses there, they taught me so much. They let me do a lot of cool stuff, and they really they gave me their wisdom and their knowledge, and they encouraged me like in anything I was going to do. Like that became my support system there, the people you work with, and it being in the ICU is so interesting. And those are the sickest patients that really need your help, because in the critical care field, it's always, you never know what's going to happen. Like, is a patient going to code, like their heart rate's dropping or their blood pressure's dropping? You never know what's going to happen, and then you have to initiate treatment immediately, and that's kind of the adrenaline that I loved. It was difficult at first, but I found that I became very passionate about critical care medicine and working in the ICU.
Well, I'm glad that we have you. So, and then for both of you, so you're in this intense environment, working 21 days straight with only 1 day off, working long shifts in an environment that had to test all of your mettle. And then you come back to Massachusetts, and Branden, you're back in school then.
Yes.
And Heidi, back to work. What was it like coming back to Massachusetts after having gone through New York and Texas for you, Heidi, and Texas for you, Branden?
Man, it's kind of like you drop off this cliff where like the intensity's high all the time because I was there for 60 days, and it was just high energy all the time, and you're under stress, so you're trying to make these decisions that are gonna be effective to help your patient. And then I'm coming home in just this completely different environment where not as many people are sick. I have to adjust to my studies. I kind of have to remember why I'm doing it. Like, even though I'd want to be an ICU nurse, it's definitely trying to come back and transition into the flow of going to school, my lectures, my exams. It was really difficult, I think. I struggled the whole month of September, I think. But I just had to remind myself of why I'm doing it, because the end goal is to work in ICU and be a nurse, and then to be able to help those people the best way I can. And I think that becoming a nurse is definitely what I want to do, and that I have to remember why. That's why I do it. Is to become a nurse.
And that's good advice to kind of, when it's hard to be in class and doing those sorts of things, to know. That's really good advice, to keep an eye on what your end game is.
Yes.
What other advice do both of you have for not only our current students, but for a student who's just starting to think about going to college, when they're thinking about what their next steps are? What advice do each of you have for them?
So I would have to say, and I talk to people all the time, as does Branden. I hear Branden trying to encourage people to go to nursing school, all the time. Yeah. I always say to them, like, is it just because you want buddies, or you want, you really want people to go to nursing school just because you have really found that, it's been rewarding, for you. So I think that that's, part of it. In my encouragement of, people, sometimes, people say to me, well, I've been a CNA for 29 years. So it's time to go to nursing school. It's time. You have that, good base. I'm not smart enough. I think I hear that, a lot. And I say, you know what? Don't ever discredit yourself, And sometimes you may feel like you're not, smart enough. But, we go to school for education, and I think that, drive and, the want and, structure and, all of those things is going to take you wherever it is that you want to be. Science for me is huge. I like the, science and, hence, the reason why I have, 3 degrees, in the, science and, social science, field. So, I think that, whatever it is, that you just have to, again, set that goal, in mind, and know that there's just ways that you're going to be able, to get there. So I encourage anybody just to take that step. Don't ever, discredit yourself. Just really take that step. Mm-hmm. The Mount is a great place to do that too.
And I've noticed it's not just the faculty. It's the faculty, the advisors, the tutors.
It's
people will.
Yeah, from the top to bottom. Mm-hmm.
Yeah,
they will bend over backwards to make sure you succeed.
Yes.
and that's the point too, is that yes, 4-year schools are wonderful, but I always came back to the Mount, because you're not a number. My professors know me by, my first name. I can have personal meetings, with them. And they're there to see you succeed. Mm-hmm. They want you to succeed. So I believe that if you have the desire to do that, to really just, take that step and don't let anything stop you from, from doing that.
And what advice do you have, Branden?
Yeah, I think that kind of, if you're thinking about anything within the science realm, healthcare is a great technology. Like even within healthcare, if you're kind of looking at like medical technology and stuff like that, I think it's just a field that anybody could fit into. And if you're really questioning and you're thinking about taking that leap of faith, just do it, because that's what I did. I didn't know I wanted to do nursing. I had applied to the nursing program and I still was like, is this actually what I want to do? And I think that if you want to help people and you kind of you value that intrinsic like reward system, it's not easy, it's difficult, it's a process, but I think it's extremely rewarding. And I think that anywhere you want to go, I think that even if you're still questioning your career field, I think that you can get it from anywhere, whether that be healthcare or anything at Mount Wachusett. And especially with the pandemic, I had a lot of uncertainty coming in, but my professors and everything, they've really been encouraging, and just keep reminding yourself why you're doing it.
That's great advice. Well, they are Heidi Burke and Branden Burke. And Branden, can't wait for May. We'll be celebrating your graduation.
Yep.
And I want to, on behalf of all the faculty and staff at Mount Wachusett, thank you for taking time. And to tell our students that, like Heidi and Branden, you will find advice and help from everyone here at the Mount to help you find what is your true passion in your career path. Thank you so
Absolutely.
much for
Thank you.
joining us.
Thank you.